Do you know that by 2025, an estimated 33 million people worldwide will be living with atrial fibrillation? With these growing health challenges come a wave of innovation and investment opportunity in cardiology. Hi, I'm Dr. Harvey Tran, CEO and co-founder of Evergrowth Biohealthcare Capital. At Evergrowth, we are always on the lookout for promising investment opportunity in the cardiology space. That's why understanding the science behind atrial fibrillation and staying updated on the latest advancement is critical to our mission. Join us as we discuss key insight, groundbreaking innovation that is shaping the future of atrial fibrillation treatment and management. From cutting-edge ablation technology to AI-powered diagnostics, we'll highlight the game-changing trend that is poised to redefine patient care. Plus, we'll take a look at biotech company leading the charge with potential game changer, not just for patients, but for forward-thinking investors like you and me. Click the Calendly link below or scan the QR code to schedule a call with me to see if Evergrowth is the right fit for you and if you're the right fit for us. Okay, so today we'll be talking about atrial fibrillation. AFib, in short, is a common heart arrhythmia where the heart beats irregularly and often fast, and that is due to the chaotic or a disrupted electrical signal starting from top of the heart, which is the atrium. So when you look at this figure right here, you can see the heart structure. This is the atrium or the top chamber of the heart. The electrical signal start here as the SA node, and then it come down to the AV node, and then it's spread through this bundle of His, and then it moves back right here. So the electrical signal, it moves through the heart in a very coordinated fashion so that the heart can beat in a with regular rate and regular rhythm. Here for patients afflicted by AFib, the heart signal, it's just very chaotic, disorder in the atrium. So only a few of these electrical signal then get through the bundle of His, and then moving backward is not coordinated, and as a result, the heart is just like it's like quivering rather than beating synchronously. There are primary cause and also secondary cause. For the main cause or the primary cause that include aging, genetic, high blood pressure, heart disease, obesity, diabetes, also sleep apnea can cause it. Secondary cause, which is the AFib that is caused by something else, that include hypothyroidism, too much alcohol, lung disease. Also after surgery, it can also cause AFib. The different type of atrial fibrillation, paroxysmal is the one that come and go and lasting less than 7 days. But if the condition persists for 7 days or more, and then that would classify that AFib as persistent. And then you have long-standing persistent AFib that occur a year or longer. And then with permanent AFib, that's when we cannot restore the heart to its normal rhythm. Effect on the body, as you can imagine, the heart, it needs to pump at a regular rate and rhythm with coordinated electrical signal, so that the blood can travel from the heart and then to be pumped to other part of the body, just like the water pump. So now when the pumping is irregular and fast, the blood tend to pool. The blood does not flow smoothly, and it tend to increase the risk of stroke when the blood pool and clot in the brain. Also, with irregular pumping, fast pumping, the heart cannot expand and then fill with blood and then pump all the blood out. That reduces the pumping efficiency or cardiac efficiency, and then ultimately that could lead to heart failure. When the heart doesn't pump efficiently, the patient does not have or you do not get enough fresh blood to go to your brain, your body, so you tend to feel tired or fatigued, also dizziness as well. And with that, when your heart does not give you enough of the fresh blood, that will reduce the exercise capacity also. This condition is quite prevalent. 33 million people worldwide is afflicted by AFib, and the key contributor is due to the increasing aging of the population. Now, keep in mind that as you live older, you tend to be sick due to more condition like heart disease, like AFib. But if you eat well, you get your rest, you exercise, also keep a positive attitude, then you can overcome this condition and surpass that 100 years old mark that I set for you. Other symptom of atrial fibrillation: shortness of breath, tiredness or fatigue, dizziness, weakness, also chest pain and palpitation. And these symptoms are manifestation of a heart that does not pump efficiently. Also, other sign: irregular pulse, low blood pressure, and also sometimes you can hear the heart murmur as well. For diagnosis of AFib, first we get the ECG or electrocardiogram. In the ECG, it will show the pattern of the heart electrical signal, and that's the primary diagnostic tool that we use to capture the irregular heartbeat associated with AFib. Now, for patients in which they have symptom here and now, and then the symptom is gone, it just come and go. To catch or to diagnose patient with intermittent symptom, we use the Holter monitor so they can catch the abnormal electrical signal when it arises. Echocardiogram is also used so that we can evaluate and check the heart structure to see if the heart structure and function is intact. We also do a blood test to exclude or rule out other conditions that can mimic AFib. For treatment and outcome, since this condition is due to the abnormal rate the heart beat fast irregularly, we use medication to control the rate. Some of the medication include the beta blocker, calcium channel blocker to normalize the heart rate. And then to control the rhythm, we use antiarrhythmic drug, also electrical shock to the heart as well, or electrocardioversion. We can also do a catheter ablation. So if the electrical signal is due to an abnormal conduction system, we can remove that. We can remove or stop that abnormal electrical conduction. Also, with AFib, there's an increased risk that the patient will have blood clot, which lead to stroke. So we also give patient anticoagulant or medication like warfarin, the novel oral anticoagulant to minimize or prevent stroke itself. The outcome is that even with this condition, it reduces risk with proper management for anticoagulant, also rhythm control. We can manage the symptom, but this situation or this condition is often a chronic condition that requires lifelong management or lifelong treatment. New medical trend nowadays, you have post-field ablation, which is less invasive ablation technology to cut out that abnormal conduction system. AI will have to improve diagnostic as well. Also wearable technology or smart watch, so on and so forth, so that we can continuously monitor the heart rhythm and heart rate as well. There's ongoing research to look at genetic marker relating to AFib so that we can personalize or customize the treatment for a patient. The more customized the treatment is, the better the treatment outcome, and also the lower the side effect. We're also looking at biological pathway to look for causes like inflammation relating to the development of AFib. Other ways to improve is again with biomarker to identify the disease early on, genomic like treatment that is tailor-based to patient genetic profile, regenerative medicine to restore or to treat the damaged heart tissue itself. Here, this slide shows you the commonly prescribed medication, rate control with beta blocker or metoprolol. Diltiazem can also be utilized as well. Rhythm control, we use amiodarone, plecanide, anticoagulant, warfarin, the bigger trend, or apixaban, or the novel oral anticoagulant. With the novel oral anticoagulant, we do not have to monitor the patient INR ratio, which make it more convenient for the patient. Here's a new medication, the factor 11 inhibitor. It's a new class of drug aim to reduce the risk of bleeding while preventing a stroke. So for new investment, if we have a small cap biotech stock that are making a new factor 11 inhibitor, that could become a blockbuster. For a drug, an anticoagulant that prevents bleeding, it can be used for AFib. If it's approved for AFib, then chances of it to being approved for other conditions would be very, very high. Here, this slide just show you new stock opportunity, like company making ablation technology, but Boston Scientific, Medtronic, they're already large cap stock. They're already too big, so even an approval for this condition with just a very small incremental value added to the company. So we want to find company that are small, have small cap around $2 billion in market cap or less, and with this technology being the key or the crown jewel technology that they are developing. In that situation, if that again FDA approval, and then the chances of the stock to increase multiple folds very, very high. Same thing here with oral novel oral anticoagulant. Now the other trend opportunities for ablation that is less invasive or non-invasive, personalized medicine, digital health solution, as I share. And that concludes my presentation.
You want to capture this lucrative opportunity while investing in the innovation that deliver hope to the patient, but you either don't have time or you don't have the expertise. Reach out to us, contact us. We'll schedule a call to see if we are the right fit for each other.